This might shock you. When you have pain in your neck or upper back that you've never felt before, you might have a herniated cervical disc. While this might be worrisome, it is not an uncommon problem as we age. In fact, you can often have one without even having any symptoms. However, in this video, you will learn more about symptoms of a herniated cervical disc and when to call your doctor. So keep watching. I have seen many patients with this exact problem in my clinic since I started practice in 2016. My name is Dr. Kristina Turkewitsch, and I'm a corrective care chiropractor in Newmarket, Ontario, Canada. I'm certified in Thompson technique, Webster technique, and I've studied chiropractic biophysics. You can check out all my other videos here on this channel where I share my knowledge about all of my chiropractic clinical experience with patients, and you can get a lot of my tricks and tips on how to deal with many of the common problems that we see today. Your cervical discs help to, so these discs right here, they help to stabilize the neck, and they help to turn the neck smoothly, and they also help to, bend forward and back smoothly. Over time, because of misalignments in the neck, these discs can start to degenerate. The spaces between where the discs are right here start to narrow, and then the nerve roots, these little guys, can start to become pinched. This process is known as cervical degenerative disc disease. Research has found that about 25% of people below the age of 40 and 60% of people above the age of 40 have some sort of cervical degenerative disc disease. And so as the degeneration becomes more severe, you start to have a more rigid neck, so you lose flexibility in the neck, and you'll start to have neck pain and tension, and then you'll start to notice that it kind of gets worse towards the end of the day. The most common symptoms of cervical degenerative disc disease are neck pain and stiffness. And this is when a herniated cervical disc can happen. As the cervical disc becomes more compressed, the degeneration starts to worsen, and what can happen is the material that's inside of the disc can rupture or herniate through the outer wall, and this will put pressure on the nerve roots. A herniated cervical disc is one of the most common causes of neck pain. And when the nerve roots have pressure on them, that's when you'll have these symptoms start to occur. And not only can it just put pressure on the nerve roots, but it can actually start to put pressure on the spinal cord itself. Now, I'm gonna list the symptoms that you wanna look out for. So when the pressure is on the nerve roots, you'll have pain in the neck, but you'll also have numbness and tingling that goes down, like into the shoulder, down the arm, and into the hand and fingers. Weakness in the arm or hand, which will make you drop things, so you'll notice that maybe your grip strength is not as good as it used to be. Also pain into the shoulder blade, so down the back, in between and right along that shoulder blade. Or you can have pain that travels from the neck up into the head as well, creating headaches and that sort of thing. Now, if the pressure is on the spinal cord, you can have much more symptoms down the chain. So you could have stumbling or awkward walking. You notice your balance is not so good anymore. Your coordination is not so good anymore. You could have, a tingling or shock-like sensation that runs down your spine and into your legs. And you would notice difficulty using your hands and fingers for fine motor control. For an example would be, you'd notice you'd have difficulty buttoning your shirts. If these symptoms describe you, and they've been there for 6 or 8 weeks, haven't gotten any better, and even maybe have gotten progressively worse over time, I would recommend at that point that you see a doctor, because once it's gotten to that place, then it's gone from more of an acute problem to a chronic problem. And when you have a chronic problem like this, it's going to need more help to start to heal and resolve this issue. And it just won't really be able to heal fully on its own anymore. A medical doctor might prescribe you some pain meds. They might even recommend, if the symptoms are really severe, they might recommend that you see a neurologist, or things like surgery might be recommended. However, to keep your neck healthy and help to heal a herniated cervical disc, and even to help prevent this thing from occurring in the future, or prevent it from occurring in the first place, I would recommend a chiropractor. While a herniated cervical disc can, resolve itself within a few weeks, if you are not seeing that, I would recommend that you get evaluated by a chiropractor, because they can find and help the source of the problem and help to correct the underlying reason that the disc herniated to begin with, as well as give you exercises to help strengthen the neck and support the spine, and help to correct any posture problems that can really help take that pressure off, and hopefully help it from reoccurring in the future. Now, if you found this valuable, please comment below and let me know any of the struggles you've been having with a herniated cervical disc, any of the symptoms you've been having, what has helped you, what has not helped you. I would love to know. And I recommend you go take a look at this video. It is, my best 3 exercises for neck pain and tension. I really think this is gonna, help you if you can't see a chiropractor just yet to get evaluated. These exercises can really help take the pressure off. So take a look at that video.